Good morning. My name is Philip Jones. This is the Let's Talk segment of A Second Chance.
And my name is Tafaro Cook, two-time kidney transplant recipient and founder of Kidney Care Coaches, where we coach people with stage 3 to stage 5 kidney disease. If you or you know someone who has kidney disease challenges and needs to be coached, hit us up at kidneycarecoaches.com.
So today we're going to have a kind of a part 2 to what we did yesterday, which was high blood pressure, the connection of blood pressure in general to kidney disease. And so today we said, why not touch on diabetes? So this is not the full thing. This is just this particular one is just type 2. We will do type 1 tomorrow. I have a video for that as well. So we'll kind of just break it up into 2 different shows. So tomorrow we'll follow up with type 1 diabetes and kidney disease. So again, like I said, today is kidney complications in type 2 diabetes. Again, we do not own the rights to this video. We'll go ahead and get started. Give me 1 second.
Type 2 diabetes can lead to a number of complications, including kidney disease. Healthy kidneys play an important role, removing waste products from the blood. Inside the kidneys, millions of tiny blood vessels act as filters. Many substances are too big to pass through the filters, so remain in the bloodstream, while smaller substances, including some waste products, flow through the filters and part of the urine. Kidney function helps to regulate the amount of fluids and salts in the body and control blood pressure. With type 2 diabetes, the high levels of sugar circulating in the blood can damage the kidneys and compromise their function. Approximately 40% of patients with type 2 diabetes have established kidney disease. Patients begin to lose their function, including their ability to filter out waste, medicines, and excess fluids from the body. The presence of protein in the urine can be an early sign of kidney disease. Symptoms of kidney disease may include swelling due to fluid retention, tiredness, itchy skin, and nausea. Kidney disease progresses through different stages as the kidneys lose efficiency and waste materials build up in the body. It also increases the risk of hypoglycemia and type 2 diabetes complications, including cardiovascular disease. The last stage usually requires treatment with dialysis or kidney transplantation. Many of the medications available to treat type 2 diabetes are predominantly removed from the body by the kidneys. Declining kidney function can affect that process. If the body can no longer filter medications out effectively, side effects may increase. It may also be necessary to adjust the dose of medication or change medications. As approximately 40% of people with type 2 diabetes have established disease, it is important that healthcare professionals consider the kidneys and the impact they have on diabetes management.
So one thing that I took from that a lot of people with type 2 diabetes should pay attention to as well is without the function of your kidneys, your medications can't be filtered out, which means that they'll be ineffective because they can't do the job. They'll be doing more harm than good because all it's doing is building up and with the toxins and things of that nature. So your kidney needs to filter out those medications that you take for your type 2 diabetes, and without that filtering to get those medications out of your system, to be able to bring the your next dose in and things of that nature, it puts you in a bad situation. So you definitely want to make sure that you stay on top of your nephrology stuff. Make sure you talk to a nephrologist, or even just see your personal physician in general. Make sure you consistently check those labs. Make sure that you're in a good place. With your kidneys, and nothing's going wrong, because again, you need them to keep yourself consistent, and being able to take those medications for your type 2 diabetes. So
when it comes to type 2 diabetes, I believe you can control it with nutrition and exercise. Type 1 is a totally different one, and we'll talk about that tomorrow. But when you see type 2 diabetes, the majority of people with type 2 diabetes, it comes down to three things: obesity, nutrition, and not exercise. And the reason why these things happen like that is because when you're overweight, your body is not insulin sensitive. That's why you have to exercise. That's why you have to move your body. So when you move your body burns up the sugar. And that's what's going on. The extra sugar is coming in your body, it's accumulating, and you're not burning it up. And that's what happens. So the body gets full of it, and your body gets desensitized to the sugar, and it starts to accumulate. And that's when you get diabetes. That's the main cause. So there's three things that I believe that will prevent diabetes throughout a whole bunch of people: lose fat, exercise, and watch your nutrition. And what I mean by watch your nutrition is cut out some of the refined carbohydrates. You get a cleaner diet, fruits and vegetables, lean protein sources, things like that. Drinking enough water, and you will see it happen. You will see their diabetes go away. I guarantee it. I've trained over thousands of people when I had my fitness business, and they would come to me, "Hey, I got diabetes. The doctor just diagnosed me with type 2 diabetes." I would give them an exercise regimen. They would work with me with that. I would work with them on a nutrition plan, and with both of those, we would drop fat. Once they stopped dropping fat, they didn't even have to take their medicines no more. They controlled it already with, again, nutrition and exercise. These things can control type 2 diabetes and losing fat. And that's what we see. We see obesity, people who are mostly obese that get type 2 diabetes. And it's because of less activity. That's what I truly believe. I've seen it work myself. I've worked with people, clients, numerous years, come to me with diabetes, and then come back to me in 3 or 4 months, surprised. "Hey, I ain't diabetic no more." And I'm like, "Yeah, because you start exercising, you lost fat, and you start watching your nutrition, and that could cease that." So those are the main things that stops type 2 diabetes. I'm not saying everybody, but I guarantee if everybody got it and they did those three things, I guarantee it would help also.
Yeah, don't want y'all to think that we mean that everybody does, but like you said, most people, if they follow those instructions, then uh they'll see a dramatic change for sure. Some people are just so far into it that it can't be changed. They have to take medications and deal with these things, which is understandable. We all go through something like that at some point, dealing with certain illnesses. But for the most part, making sure that you're eating right, you're exercising, and things that are consistently. And that's the thing. It's not just Monday, okay, I ate me a salad, gave me some, put some extra vegetables in there or whatever, and then Tuesday and Wednesday you went and had 3 hamburgers or something like that, and greasy ones at that. It's about the consistency in it, making sure you can stay consistent in your nutrition, staying consistent in your physical activities and things of that nature. So make sure you try to make if you have type 2 diabetes, try to incorporate those things in your life. Start off with walking, and escalate from there, as you can. Change, make start off with a different diet. Your nutrition goes along with that physical activity aspect of it. So put those two together, and you'll see a dramatic change for sure. Even if it doesn't necessarily go away, you notice it and how you feel and go about your day on a daily basis. So definitely try to incorporate those things in your life. You got anything else, Mr. Cook?
Yeah, I will say, don't, if the doctor gives you medication, by all means, take your medication. I'm a big proponent of taking, listening to what your doctor's telling you to do. But you also have to take it in consideration with what you have to do. We sometimes we get complacent when we go to the doctor and we leave it to the doctor to get us well. No, you got to get yourself well. That's what that's about. You got to take initiative and do things for yourself. Damn, just listening to the doctor and say, "Okay, I listened to what the doctor said, it ain't working," and then you want to blame the doctor. You owe it to yourself to get, lose weight. You owe it to yourself to start eating right and create, a better environment in your body. And then you will see these things dissipate. And what I mean by dissipate is diabetes. You will see it get better. And I'm not saying it's going to be an overnight thing, but you're going to have to put some work in. And that goes for everything. That goes for if you have high blood pressure. You got to take some initiative too. You got to start watching the foods you eat. You got to start exercising. You got to start moving your body. I've had people come to me who were on dialysis and they were type 2 diabetics. And I gave them a small regimen of exercise and they were consistent with it. We changed their nutrition and they were consistent with it. They lost fat and in turn their body became insulin sensitive. And once that started happening, the A1C started going down and they start getting better and better and better. And that's what it's about. So again, you got to take some initiative on your own. You can't just sit around listening to the doctor and say, the doctor gave me this medicine, I'm going to take it. Yeah, that's fine. But take some initiative on your own and start being your own person. Be your best advocate, your own best advocate. And take some initiative of your own and do what you got to do to get better yourself. I don't have nothing else to say.
I'm done. So that was our Let's Talk segment for today. Like I said, tomorrow we'll touch on type 1 diabetes and kidney disease. Like I said, these three things are the leading causes of people getting going into kidney failure, which is high blood pressure and diabetes. So we want to make sure that you are educated in these things, or at least have some things to help you make some changes in your life to kind of not necessarily. Our goal is to get you out of these situations by all means, but we know again, like you said, everybody is different, right? We all have our different ways we've gotten to the position we're in. So, like you said, it's not gonna happen overnight. You got to put some work in. So definitely take that into account. But make the change. It's all about what you want to do and how you want to make that change in your life. So, let's get to it. At this physical
And
activity.
kidney care coaches can help you with all of those things also. We can help you, prevent you if you are diabetic and high blood pressure, we can prevent you from letting those be the causes of your kidneys failing. We can write you out nutrition plans. We can write you out exercise plans. We can help you and keep you accountable. That's what we're designed to do. We're your accountability coach. And a lot of people need those accountability coaches because they can't just stay on track by themselves. And we get it. And that's why we work with people. And our results are looking good, man. With the clients that we do have, our results are banging. People are starting to see results, man. And I'm talking about people on dialysis getting better. And so if people on dialysis can get better, we want to present you from that stage so you can always get better. So remember that.
Cool. Definitely check in kidneycarecoaches.com if you have any questions or need some advice in any of the departments Mr. Cook just mentioned. We're done. Again, like I said, we'll be back tomorrow morning, same time, 10 o'clock, talking about the connection of type 1 diabetes and kidney disease. So we appreciate you who's watching today, watching in the future. Like, comment, subscribe to the YouTube channel. If you have the chance, we appreciate it. Appreciate your love and your support, and we'll see you in the morning.